Hi, we're going to be doing an assessment today on the musculoskeletal system. As you can see here from Mr. Skeleton, we'll of course have a real model for you. And the musculoskeletal system is the system of the body that contains the muscles, bones, and joints that allows for movement and support of the body. Let's get started. So as our patient enters, we're going to take note of their gait, notice any posture, balance, or gait issues that they may have. This is Joseph, and he's going to assist us today in our musculoskeletal assessment. And as with other assessments that we do, we're going to start with the head and move downward. And from there, we'll go inspection, palpation, range of motion testing, and strength testing as well. So we're going to start with the head, and essentially what we're going to do first is just take a look. We're going to notice any asymmetry, any obvious bulges or masses, and then we're going to go ahead and take our fingertips and start to palpate right around here at the temporomandibular joint. So then we're going to ask our patient to open their mouth and go ahead and close it for me. And one more time. Okay, and we're going to take note of any cracking or audible noises that we hear to indicate that there would be an issue with TMJ. Okay, so now we're going to note any issues with symmetry or masses of the head, the neck, and the cervical area and the shoulders. So we're just going to quickly palpate. We're going to note any masses underneath the surface or any muscle spasms that would indicate an issue with the muscular system. So we're going to do that anteriorly as well as posteriorly. Okay, and we're going to ask our patients to just lift their shoulders up, shrug your shoulders, okay, and let them relax. And just note the symmetry and the rise and fall of each of the shoulder blades. Okay, so among the last things we're going to do with the head are the range of motion exercises. So we'll want to test for extension and flexion as well as rotation. So we'll just ask our patient to flex their head forward, chin to their chest about 45 degrees, back to a neutral position, and then extend it back about 45 to 55 degrees. So we'll want to note any difficulty there or any asymmetry as well. We're going to ask them to do the same thing with lateral bending to the right and the left, about 40 degrees on each side. And then we're going to ask them to rotate their head as well. And again, we're going to note any asymmetry, any masses, or any bulging. Moving on to the shoulders, we're going to again want to palpate the joints and note any crepitus. And then we're going to ask our patient to perform the range of motion exercises. So if you have your patient sit as this, and then lift their arms forward, okay, and then extend them back all the way behind them, okay, and then ask the patient to put their hands on their back, and we're just going to note any asymmetry here as well. So now we're going to assess our patient's elbow. So we're going to want to feel underneath, palpate, and when we do this, ask them to bring their elbow up, and then to the side, and inward as well. So always want to test the strength of the upper extremities as well, because that not only could indicate a musculoskeletal problem, but also a neuro problem as well. So we're going to have our patient put their hand up and have them push you away, and then you do that on both sides. And then they'll have them pull your hand toward their body. And there you just want to assess if they have full range of motion against gravity. So we'll want to assess bilaterally to ensure that there's equal strength. So moving to the lower extremities, we'll want to inspect and palpate the hips. We want to have our patient raise their leg and note any cracking or crepitus that we hear. So then we'll have our patient raise their knee and then over the other side of their body. And again, we're assessing the hip joint here. Adduct and abduct their leg. Now we're going to continue to move down the body. We're going to focus on the knees at this point. One of the most important aspects of assessing the knees is inspection for any differences in color, size. So what we're going to do is we're going to lift the leg, okay, and again we're going to palpate and note any crepitus. And we'll also really want to focus and palpate to note any issues with the synovial fluid or any potential bursitis. So we'll also want to assess the strength of our patient's lower extremities. So we'll want to have them push out, okay, very good, and then pull back into their body. Excellent. So we'll want to take note of any difference in the strength bilateral. Assess our patient's spine. We're going to inspect it and have our patient bend forward. And we're going to feel his vertebrae and note any asymmetry or any curvature that would indicate a possibility of scoliosis. Upon the completion of all of our assessments, we'll want to take a step back and note the appropriate nursing diagnoses that could be applicable to our patients. So for a musculoskeletal assessment, we'll want to consider impaired mobility, risk for falls, and activity intolerance. Some interventions we might want to consider with these three diagnoses for musculoskeletal disorders would be assessing range of motion as we do during our assessment, and noting any deficits and recommending any range of motion exercises.